Welcome to the eSpot with Camille. I'm your host, Camille Cower, and today we're having a very special interview. It's with Dr. Tiffanny Jones, who is a fertility specialist based out of Dallas, Texas. We're going to talk about women's health issues. So, if this is something that you're interested in, please make sure you share with your friends and colleagues, other people that may gain a lot from this information because we're going to get really dive into all the different myths and different treatment options. So, again, if you know somebody with a uterus, share. They'll need this information. All right. Without any further ado, here is my beautiful guest, Dr. Tiffanny Jones.
Hi, thank you so much for having me.
The pleasure is all mine because I have to say, finding a doctor that's able to talk about these topics in a way that us regular folk can really understand is difficult sometimes. And when I saw you on the We Can Wear White Project's Zoom that they had a few months back, I was like, oh, I got to get in touch with this lady. I have to have her on my show because to go back, I've been suffering with or was suffering with fibroids since my 30s, and I'm 46, and just finally had enough this past August and reached out and tried to get treatment and got treatment. And even with my doctor, although she did a beautiful job, I'm healthy, I'm here. Like there wasn't a lot of bedside manner. There wasn't a lot of opportunity to really understand what was going on with my body. And they kind of make the assumption sometimes that you understand every organ in your body, how it works, what this means, what that means. And so when you were breaking it down and just really explaining the treatment options and what the myths and so on, I was just like, oh, I got to have her. So thank you for being on my show and for getting that information out there. Cause I mean, you're a doctor, you guys are busy. You don't
Yeah,
have to do this, so
no, it's
especially on
my
a
pleasure.
Saturday. So thank you so much. Now, just to get a little backstory about you, how did you get into being a fertility specialist?
Yeah, so to be a fertility specialist, you have to go through OB-GYN training. So I fell in love with OB-GYN just on regular rotations that you have to do when you're a medical student. And then I had the opportunity to go to USC, LA County USC for residency, and I was introduced to fertility then. And I fell in love with it because they are so many aspects of medicine and science, and you're really working closely with women, a lot of women who are super goal driven and have put off their fertility goals to ascertain other goals, and then have to struggle with infertility. Is something that people usually don't think is going to align or come their way, and helping them get through that, helping them achieve that goal to complete their family is so fulfilling. So I love it. I love women's health and fertility especially.
No. Now, from your experience with working in this field for such a long time now, what what have you noticed as far as the different trends in treatment? Because there are so many different areas to OBGYN, and I find some of the things can be kind of barbaric, but there's some
Mhm.
that are still um, like they're it seems like they're going in a direction where they're really trying to save your uterus now. They're really trying to protect the opportunities to be able to have children later on in life. So what do you see as far as like coming on the horizon with treatment options for women that are putting off having children until their 40s, their 50s? Like,
Mhm.
like not everybody has access to Janet Jackson or other women's opportunities, but for the common person, what options are there, or what are you seeing coming?
Yeah, I would say even in my early training, we did a lot more hysterectomy, a lot more oophorectomy, which means taking out the ovaries with the uterus. And I definitely think we're doing more preservation now, especially when you look at ovaries and the long-term effects of having, like a chemical or like a castration. You're removing the ovaries, removing hormones from the body before the onset of menopause can really be detrimental. For women who haven't completed their families, taking out their uterus is really not an option, and I think a lot of people present that as a first option. I had a patient who was in her early 20s with very small fibroids, and it was recommended to her without anything else. And I'm just like, this is insane. So it happens, but I think there also is a changing of the guard. If you look, maybe 20, 30 years ago, most OBGYNs were men. Now
Mhm.
the field is really predominantly women. And so I think that really helps just so people understand what the goals are and aren't looking at it in a paternalistic way. A lot of OBGYNs, they have their babies late, so they can really empathize with a patient that is in their 40s and, just starting their families, because that's what we did too. And trying to save the uterus and really focus on early prevention is paramount to saving those organs.
No, and you bring up a great point by it the just the changing of more women being doctors, they're advocating for more women in that sense too. So I love that you brought that up because I didn't even think of that being a reason, although that clearly makes sense. Now, I want to back up a little and explain a little bit what fibroids are, why so many women suffer from it, and what do you think is the main reason behind such large women suffering with fibroids, because it's very common, but it's not really, you don't really hear about it in the news. Or I mean, it's starting to be heard in the news because there's different bills and so forth that are talking about fibroids now. But I mean, I hear after I had my surgery, all of a sudden aunts, great aunts, like all these people came out like, oh yeah, I suffered with that, I had to have a hysterectomy, but it seems to be one of those things that people don't really want to talk about yet. So what are your thoughts as to why? Is it maybe that same taboo of because they were performed by men and just was kind of hush hush? Or is it just that this generation is like, we're telling everything? If it happened to me, it must be happening to others, let's share. Yeah, so what do you think is the change in that? And also, again, if you could describe or educate more about fibroids as well.
Sure. So fibroids are benign tumors. They start off as a single cell, so you can't see them, but they grow rapidly, or those cells rather grow rapidly. Fibroids themselves are slow growing tumors, so it'll take years before someone may have symptoms. And a lot of women don't have symptoms at all. I
Mm.
think the reason why most people don't know they have them is because the way we're trained is doctors are, really just to focus on symptoms and not as much as prevention and really looking into the highest risk people for what they could have and just to alert them so they are aware. For instance, we're trained to do pap smears to prevent cervical cancer, but in Black women where the prevalence of fibroids are upwards of 80%, you may never ever have an ultrasound, right? Because if it doesn't hurt you right now, then just leave it alone. Don't even know you have them. But then 5 years later, that fibroid that was really manageable at a small size is now 10 centimeters. And now you have to have, a major surgery because it's preventing fertility or it's, causing heavy bleeding or pain. And the other thing is we use birth control pills or hormonal regulation a lot when people do have complaints without delving into the actual issue, which in some women who look like us may be fibroids. And so not doing ultrasounds early and not having it as a part of the algorithm for initial onset of some symptoms really does miss the mark, and having things, delayed, or people not even knowing that they have them. I think that you hit the nail on the head when you said, like the newer generations, we don't tell everything. You have Instagram, you have YouTube, you have TikTok, things that were not available 15 years ago. And so people share their stories and people want to hear, they want to form a community, like the White Dress Project, it's so important. It happened to me. I want to make sure that other women know, like, don't wait, don't, like ask these questions, because I didn't ask these questions and look what happened to me. And so it does become more pervasive because, not that fibroids weren't around, it's just people wouldn't talk about them. And there's also cultural things too, where different cultures don't talk about certain things. Like your mom may have had a hysterectomy and you didn't even know.
Mhm, mhm. No, you bring up so many great points, and I'll just share a little bit about my backstory. When I was first started suffering with fibroids, I just figured I just had heavy bleeding. I would make sure certain days of the week I wouldn't work because I couldn't handle work anyway. Like the pain was so hard. And then finally, I started going to the doctor because I was like, this can't be normal. Like there has to be something they can do. I was advocating for stronger birth control pills, because I was like, it's going too long. Like my periods were more than 7 days, and so they were doing that. They never really tested me, like you said, with the ultrasounds. And it was my 30th birthday, and I went to Hawaii to go celebrate with my mom, and it was as if everything fell out of me right there when I got out of the car when we were getting ready to go into the Polynesian Center. And so my mom and her fiance at the time were in horror and were like, oh my gosh, we're going to take you to the emergency room. Flew as fast as we could to the emergency room. We get there, they finally do an ultrasound and so on. And immediately, like, you have fibroids and we need to do surgery. And I was like, well, just take it out, because I don't want, at that point, I didn't want kids. And so I was like, if this is what's been causing all this pain for me all this time, just, I don't need it. But she was like, you're still young. You may change your mind. I had surgery. I had a DNC, and I can't remember the other part of it, but I had uterine fibroids, and yeah, I can't really remember what it was called now. I meant to write it down, but forgot. And so I had that procedure done. Fast forward maybe 2 years, my doctor was right, because I got pregnant with my daughter. And, and again, the male doctors weren't listening to me when I went to them and told them that my previous surgeon had suggested that I would need to have a C-section based on my fibroid issues. I had 15 fibroids while I was pregnant with her. I had gained up to 70 pounds as well while I was pregnant with her. And like, you could feel them, and people would always like, oh, I can see an elbow. I'm like, that's probably not an elbow.
Like, that's
But thanks
rib
for
right
sharing.
there.
Or they would tell me, oh, you look like you're pregnant with twins. Not funny, but thank you for sharing your information there. And so when I had her, I did end up changing to a woman doctor, and she did perform it by C-section. And even then, she was like amazed by all the fibroids I had. And then 10, well, she's 13. So 13 years later, I was suffering again. And in between that, I did like do marina and different things, because I was having very long periods again and just suffering. Never could go on vacation, or because everybody would be in the pool but me, or at the beach, because I'm like, I'm not trying to be shark bait. Thanks for playing. So I finally was like, I can't take this anymore. I like, my entire life is based around my flow chart, and I
Right.
can't do things. I can't show, like, I work in entertainment field too. So it's like, I was scared of wearing clothes and possibly ruin them on set if I didn't get a break soon enough, so on.
Yeah.
So I finally went back to my doctor, and when she said, because I had like an ablation, different things of that nature, just kind of pacifying the symptoms for a couple of years here, a couple of years there. And when she said hysterectomy, I was like ecstatic about it, because I was at the point where I'm like, great, I won't have to suffer with this anymore. I'm 45. I'm not having any more kids. We're good. Plus, my pregnancy was so awful. There was no way I was going through that again. Well, so I had my hysterectomy. Like, the freedom I have now, like, I'm like, is this the way everybody else lives? Is this what I could have had the whole time? Like, my doll did not cut this. So, um, I want you to share, what are some symptoms that women should look out for, because there's also that understanding, like, everybody just expects for periods to be painful. They expect for it to
Yeah.
be certain things that you have to deal with. But when is it to a point where you definitely need to get medical intervention, or at least reach out to a doctor to make sure that it's not some other underlying symptoms, not just fibroids, but any other uterine conditions that may cause concern that they should get seen immediately? Because, I mean, ultrasounds aren't so easy to get by, and maybe depending on their medical insurance, it's not,
Right.
they have to do a lot to get to that point where they'll even approve it. Because that was the other part. Like, I had to get my husband's approval for some of the different things I had done. And I was just like, what if I was single? Like, let's just pretend I'm single. Like, he's not going to take off of work just to sign a paper. But yeah,
Right.
so can you share about that as well?
Sure. So, I think the barometer should be yourself, right? If something just doesn't seem right, that's when you should really seek help. The problem is, I think, as we talked about before, like, sometimes you don't share enough, so you don't know that, like, oh, okay, my period, like, your period's only 4 days? What? Mine's 12. Like, that's not normal. Like, no,
Mhm.
that's not normal. So sometimes the barometer being yourself, if you don't have anything else to base it on, you may think something is normal and it's not. So we also have to educate people on what norms are. There are apps for period tracking, and they have built-in education. We should definitely be educating young women in school, starting in middle school, because that's when most people get their periods. But when something doesn't feel right, we should all be seeing a doctor. You should have an OB/GYN that you see annually. You guys should be able to have these discussions, and you should have a thorough history taken. So even if you don't realize something is off, like I know that 7 days is the upper limit of normal, and that, like if my patient's anemic, like this is something else is going on. I think we, especially Black women, we push through, like we just, I got to get to work, I got to do this, I got to pick up the kids, I got to cook the dinner. It's like, dang, I'm tired. I'm winded going up the stairs. Oh, I'm craving ice chips all the time because I'm anemic. My blood level is 5, and we still push on even though normal is 12. So asking questions, talking to people, and then educating yourself on what is typical and knowing what's normal will really help get earlier interventions. I definitely think our healthcare system has to change. Like, so for me, like in a fertility field, ultrasound is a standard part of every workup, right? And I think most OBGYNs actually have ultrasounds in their office. They're not utilized enough. Again, because patients do have to pay for them if insurance is going to deny it, because, oh, the first part in the algorithm is just give her birth control pills.
Mhm.
And then we'll wait 5, 6 years, and then, now she has to have a hysterectomy. So a lot of things need to change. But first, I say, if you think something is wrong, please talk to your doctor.
No, that's great. Now let's get into some of the myths about fibroids because I've heard everything from hair products cause it, soy. Like, is there anything that does actually feed it? Because even with birth control pills, I was led to believe
Mhm.
that that would even increase your fibroid chances. So, any of those you want to debust
Yeah.
or agree with?
Yeah. So, we don't know the actual cause of fibroids, okay? But it's likely that it's something genetic. It's something probably that happens in a single cell, something that's probably passed on that we'll find that's linked in families, but we don't have the exact gene, the exact markers to identify it for every person. And then also, it's hard because not all fibroids are probably the same. But what I will say is that there are some things that absolutely do feed them. It may not start to cultivate them, but it may help aid them in growing faster, and becoming more numerous. So when you mentioned soy, so soy is a phytoestrogen. Estrogens, we know, stimulate fibroid growth. Women in our reproductive years, we make estrogen. It's a part, it's normal. So our normal physiology will feed fibroids. So when you add more on top of that, yeah, you can actually help them to you actually feed them. So soy products has been linked. Some studies show red meats can be linked. I am not a vegetarian myself, and I do know vegetarians that have fibroids. So there's also, I think the myth is that there's going to be one cure. Some people say, like fast and take these supplements and things like that. And there is no one thing that I've seen that can completely be a cure for them. And even when people have surgeries, they have to know that because they start off as a single cell, fibroids can come back. And I think that's something when we're doing our initial counseling that is not really discussed deeply enough, because I find so many patients are so shocked when 5 years later they're having another procedure.
No, I same because I was like, oh well, now I don't have to worry about fibroids anymore. I had my DNC. It was just that one,
Hmm.
and granted, she did kind of warn me, but it was still a matter of like in my head, I didn't hear any of that. Might have been the medication I was on. All I heard is I couldn't have kids, and so I was like, great, I'm gonna live my single life and just focus on my career. And then my husband and I found out we were pregnant. Funny enough, watching a movie called Knocked Up, and like
Uh-huh.
she was
Yeah.
talking about all her different symptoms. I'm like, wait. Wait. And so I went straight to the Kroger and bought like a 3-pack, my first time ever buying pregnancy tests. And it was so funny because my husband and I both, like, soon as I took the test, it went positive immediately, like pregnant immediately. I was like,
Yeah.
oh, wait, maybe we have to wait because in the movies, they're always waiting.
You were super pregnant. You was about 2 months, 3 months off.
It was even funnier. Is like I was like, well, let me take another one. And the fact that I could take a test that quickly, like, proved something was on my bladder that I could, on demand that
Right.
quickly and so on. But I was in denial for a little while and just like, it's probably just fibroids because one of my mom's friends, we visited her in the hospital when she had to have a fibroid removed. And because it was connected to her ovaries, I believe,
Mhm.
it had gained some DNA into it. So it had hair and different things. And I was just like, it's probably just a fibroid that has some DNA in it, like, because I was like, I am a career
That's
person. I
called a
am not a mother
dermoid.
type. A dermoid? Okay.
Yeah,
Yeah.
dermoid.
So honestly, it was like until I heard the heartbeat, I was like,
Oh
no, it's
yeah.
probably a fibroid. It's probably, I'm not mother material. And it's so funny. The minute she was put in my hands, I was sold. I was like,
You were
I'm going
mother
to be
material.
like, you're never leaving my sight. I didn't let her go to the nursery. The only time she left me in the hospital was when they did the sound test or the hearing test. I was just so obsessed with her because I guess because I was told I couldn't, and then
Right.
had that mentality of like protecting myself from that, even feeling those kinds of emotions for it to be taken
Mhm.
away from me. And although I didn't have a miscarriage, a lot of times
Right.
miscarriages are very common with fibroids too. So I was kind of scared of getting attached that way as well. And I think for a lot of women out there that suffer with miscarriages or with fertility issues, it's hard to believe that you're going to get this miracle until it's in your arms. So,
Mhm.
what are some of the things that people can do maybe to help prevent having to have a hysterectomy or to take away those fertility options from them? Like, what other treatment options? Granted, I know you have to see them to know, but what other
Mhm.
treatment options can they ask their providers about before getting to the point of hysterectomy? Because I'm lucky that
Yeah.
the lady that diagnosed me didn't listen to 30-year-old me because 32-year-old me couldn't be happier with being a mom. And even to this day, she's definitely the best thing that's ever happened to me because she changed me from being kind of more of a selfish person, I'll admit, and not very understanding to other women either. Because I was kind of like, what do you mean your kid's sick again? Like, yeah, and now I get it. Like, oh my gosh, they catch everything. And it runs like rapid fire through the school and they'll get it again sometimes. So can you share a little bit about how more women can get that opportunity, or at least what they can ask their doctors about before having to go through a hysterectomy?
Yeah, so the first thing is mapping the fibroids, knowing where they are, because not all fibroids have to be treated. I think that you should know about them.
Mm,
You should know where they are, how big they are, and you can do surveillance. I think knowledge is power in that respect, where we shouldn't be afraid of the diagnosis, but not all fibroids need to have surgery, or intervention. You can just follow them. So when fibroids are in the muscle layer of the uterus, and we have three layers, we have the serosa, which is like the skin covering of the uterus. We have the muscle layer that contracts, and that's usually where we have the cramping pain and what helps us in labor. And then you have the submucosal layer or the endometrial cavity, and that's where the embryos implant, babies grow, and that's also what sheds when we have a period. That's the layer that if there's a fibroid, it can really cause some problems with fertility. And most of the time, a lot of the symptoms are from fibroids in that layer. Those fibroids can be treated without incisions. So you can have a fibroid removed that's submucosal through what's called a hysteroscopy. And so when you mention a DNC, it's possible that you had a hysteroscopic DNC where they
I
put a
did.
camera. Mhm.
Yeah, yeah.
So they put a camera inside of the uterus and it goes through the vagina into the cervix and into the uterus. So that's a natural cavity. There's no incisions. And then that fibroid can be shaved out and removed. And it's a day, a same day surgery. You do have anesthesia, but you go home same day. And some women can go to work a couple days later or even the next day. And so those kind of fibroids, really can make a lot of difference in treating early, especially before they get too large, where that approach may not be as successful because to do a hysteroscopic surgery, you are limited by time because a patient can absorb too much fluid and you have to stop even before you finish the procedure. So diagnosing them early, getting rid of them early can really help have a minimally invasive procedure over something like a myomectomy, which is the other gold standard for removing fibroids that are in the muscle that are submucosal or in the skin layer, subserosal. That is not a day surgery usually. Some people have to stay overnight in the hospital. You definitely get an incision. There's more pain there, more time off of work. And so, yes, some people have to do that, especially if their fibroids are very numerous. And so, when you say you have 15, removing just one may not help with all of the symptoms, but you can do that kind of surgery laparoscopically through small incisions going through the belly button with a camera, and there are expert surgeons that can take those out in that way, where you're not having so much time off of work, but still more than a hysteroscopy. Or you do it open, which is like a C-section. And I did one on a patient, and she kept telling all her friends, my doctor did a C-section to remove my fibroids. And I was like, don't tell people that because they're gonna think I'm crazy. I did not do a C-section on you, because that's only to remove a baby. But it is like the same type of incision. So it's a small incision in the right above the pubic bone that can be hidden. But again, it takes more time to heal from that, and it's more painful. But in some women, it will be the difference between them saving their uterus or, going the route of a hysterectomy. There's also some newer approaches that I'm hopeful that will pan out for women who want to save fertility. But even if fertility isn't the most paramount thing, some women just don't want to have a surgery. They don't want to be cut. They want something minimally invasive. So uterine fibroid embolization is something that a radiologist does, an interventional radiologist. They take a catheter through the artery, and then they block the blood vessels that supply the fibroids, and they can treat many fibroids that way. And it's, something that will cause the fibroids to die and shrink. Usually they don't go away completely, but sometimes you can get enough relief where you can avoid a surgery. Okay. Acessa and Sonata are two newer treatments that I'm really excited about. Acessa is a laparoscopic uh, ablation of a fibroid. Ablation means you put a probe in the fibroid and you heat it up. So it's kind of like you microwave it a little bit, and it can kill it, soften it, and shrink it some. Sonata is an incision-free ablation approach. So just like a hysteroscopy, it goes through the vagina, through the cervix, and into the uterus, and it can heat up fibroids in all of those layers, potentially treating a woman without having any incisions. Right now, as far as pregnancy data, there's not a lot. Women have become pregnant after all of these types of procedures, but it's just not the mainstay. We just need more data to say that it's absolutely safe, because what we wouldn't want is for someone who really wants to preserve their fertility to have it lost with one of those type of procedures. So time will tell if they come to fruition where it is a great approach for those women. Right now, I perform Sonata, but I do it in women who've had multiple myomectomies and just can't have another one, or who want to avoid having surgery and fertility isn't paramount to them.
No, I'm glad you brought that up. I want to make sure, is there any other things that you would like for people to know about fibroids, and also about the different um, offerings that you offer at your clinic in Dallas? Because I want to be very considerate of your time, because you are a doctor and it is a pandemic. And I'm sure a lot of people are like, I want my baby boo during the COVID baby happening. So what can
Well,
you share
luckily
before we go?
we're off this Saturday. But
Yeah.
yeah,
Okay.
I think the biggest take home message is to get a doctor that you can form a really good relationship with, that you don't mind seeing every year. You don't mind discussing, the most intimate parts of your life, and talk to people, understand, what's going on with you, what's going on with them, so you can see if something is out of the norm. And don't be afraid to ask questions. And if you have a doctor that doesn't like your questions or doesn't want to answer your questions, you probably need to interview someone else to take care of you. There are many options: hysterectomies, myomectomies, ablations, embolizations, all kind of things. And anytime you have an issue, you shouldn't be presented with just one option, because then you're not really given an option. You're told what to do. So even though some options may be best for some people, you should be given every option to make the best choice for yourself.
Yeah, thank you so much again for being my guest. And how can everyone keep up with you, find you, or if they're in the Dallas area and need a fertility specialist, where can they find you?
So I'm at Conceive Fertility Center. We have clinics in Irving, Dallas, and Frisco. You can follow me on Instagram at tjonesivfmd. And yeah, I'd love to see everyone.
Okay, great. Well, thank you again for being my guest. You've been amazing. And I love all the information you shared. And for all those women out there that possibly are suffering, or girls, or anyone with a uterus, I just want to make sure you know to definitely take Dr. Jones's advice. If you're not being listened to, find someone else, because it can make all the difference in the world finding someone that will take your concerns seriously, because you just never really know. Because there's also so many other things that can resemble fibroids that aren't fibroids. There's also PCOS, there's endometriosis, which I had never heard of, which I found out I had after the fact,
Oh, endometriosis.
endometriosis.
Yeah.
There's so
Mhm.
many different other things that we did not speak about today, but definitely go and check with your OBGYN and or fertility specialist to find out what options work best for you, because it's a light. It's so like my life is so much better now that I want everyone to feel this way.
Yes.
You do not have to be tethered to your app to figure out whether or not you can go on vacation that week or
Right.
whatever. And normally, even though it would tell me, oh, it's coming soon. It never was right. Like it would be like, oh, we know you're on vacation, you're going to the pool. Let's go ahead and ruin it for you. Like instead of that, the mayhem commercials where the guy
Yes.
is that was my
That.
period. It was like, oh,
Mhm.
let me just ruin this for Camille. So, and now I can wear white, which is also
Yes.
a great thing, which
Yes.
I have not worn
Anytime
since
you want.
anytime I want. I'm wearing it in winter, after Labor Day. Nobody's stopping me. So, again, make sure you keep up with my guest, Dr. Jones. Thank you again for being my guest. And if you know anyone that is suffering or needs more information, please make sure you share this episode with them, because you never know who you're helping. All right, and have a great day. Thanks for watching the E Spot with Camille. I'm your host, Camille Cower.